There's one huge part in this that up until now we've left out: the socioeconomic inequalities that affect overall health.
We're learning more and more that health is not just about those healthy behaviors that you do, but your zip code can determine your health.
A big problem in Louisville especially is segregation. The neighborhoods in West Louisville are more than 60% black, while East End neighborhoods are more than 90% white.
So there was a report that was just done that showed that there was redlining as far as real estate, so who could live where. And so that's why we have so many people of color concentrated pretty much in just certain neighborhoods. And it's creating a really dangerous situation.
What Karen is talking about is redlining. Redlining is when investors refuse a loan to someone because of a perceived notion of poor finances. And earlier this year, a project came out showing that redlining with housing is what created the problem with segregation that faces Louisville today. This project was done by Joshua Poe.
So redlining was a grading system for capital lending in neighborhoods. And what that did was it really inhibited people's ability to create wealth, because most of the places that were redlined were places where black people lived, and they were redlined solely because black people lived there.
Government officials would mark neighborhoods into 4 categories, and neighborhoods in the lowest category would not receive investment, while the highest category would receive overinvestment. This was purely on a racial bias, and it created today's problems.
Men like Harlan Bartholomew and early planners would actually sit down and analyze a city and try to predict where African Americans would move in that city. They would then zone those areas industrial. So they would ensure that African Americans were going to live in industrial areas or near industrial areas for the next 100 years.
This is a call to action. It means a few different things to Poe.
It's important to study those lessons from the past, so that we don't make the same mistakes. I think by acknowledging the research, the public officials and local government has a real responsibility to reinvest in these areas. I think that's sort of a major first step. There are 3,000 vacant properties in West Louisville, give or take a few. We could reduce that by a third. So I think a logical plan that the city could take on would say we're going to rehab 1,000 vacant properties in the next 3 years.
We haven't really come to terms with how our institutions have contributed to health inequity.
But there is a government organization addressing this issue specifically.
We really talk about the work that we do in the Center for Health Equity, as I like to describe it, everything that people think has nothing to do with health. So those are those root causes: economic development, neighborhood development, educational development, our food systems.
Louisville Metro's Center for Health Equity was the first of its kind in the country. And since it was started in 2006, they've made some progress.
Specifically in the center, we've got 3 initiatives, and that is community capacity building, youth engagement and development, and environmental justice.
In the community capacity area, they release a health equity report every 3 years that looks at where the city is at on different social determinants of health. For environmental justice, they're at the table when policy is made, and they weigh in with the equity point of view.
In the past, we've had a vibrant program called Healing Future Fellows, program where we had young people come over the summer, 25 young people that were with us over the course of 4 summers. This summer we created our Racial Equity Youth Council, and so they're actually creating plans that will change systems and policies for 16 through 24-year-olds in the city.
The center's priority is highlighting what's wrong and influencing other departments of the government. Dr. Pryor recognizes the issue with vacant properties, and when legislature is enacted, she brings the context of health to the table. Solving health issues and reducing inequity is clearly a complex problem. The Center for Health Equity was put in place to help the city move in the right direction.